I am very aware that I tend to look at everything in terms of shades of gray. I've mentioned that on a couple of other videos. One of my favorite terms is it's not that simple. So, a couple of references to movies, Shades of Grey, and the other movie, I think It's Not That Simple, came from The Notebook. And I also realize that people, especially on YouTube, just want a very simple fact to be stated. All of us like to have facts that we can rely on. One of the problems is that I focus on making sure that my viewers are aware of the actual science. And so quite often the actual science is very muddy. Man is not as smart as man thinks sometimes, and we struggle with our science. But I got a comment about this last night. John Walker, the research and the verdict always seem to be inconclusive on this channel. Okay, I'll take that. My response later on was, I wonder why. Do you think that might be the reality? But it got me to thinking. I really do want to make sure that there are a lot of conclusions that you should get from my channel. If you haven't gotten them, shame on me, and maybe shame on you. Okay, let's go through some of those conclusions, some of those truths. Number one, you can reverse plaque. There's no question. Despite what your doc says, despite what the assumption about this is just old age, you can reverse plaque. I've done it. John Lorscheider's done it, and plenty of my patients have done it. Number two, you can reverse most diabetes and insulin resistance or prediabetes. Really? The CDC said, and everywhere else, ADA, I'll say it's a chronic, irreversible disease. There's a very critical question about the term reverse. Most people can clearly reverse the course of their disease. Again, I've done it. John's done it. There's a whole book about this. Read The Obesity Code by Jason Fung. Time and time again, he talks about patients that are overweight that come in and reverse their diabetes. It happens all the time. For those of us whose insulin resistance is being caused or contributed to by being overweight, that is the simplest item. I didn't say it was easy. Glycemic carbs are not harmless if you have insulin resistance, prediabetes, or type 2 diabetes. No matter what the ADA says about the ADA recommended diet with all those carbs and breads and grains in it. And I'll actually add another thing here. Grains tend to be a bigger problem than sugar. Now, pardon me, I know that's going to create a lot of reaction. Fructose for sure, glucose, sucrose, straight sugars are a straight shot to your arteries. And from that perspective, they are a major hit. They're a quicker hit. They're a harder hit. However, just think about the amount of carbs in a big bowl of pasta versus the amount of carbs in coffee that you sweeten with your sugar. The whole point is, for most people, pasta and grains, white breads, even highly finely ground whole grains are a major and bigger problem because they get so many more of them. IR, diabetes. Number 4, IR and diabetes is not just obesity. It's not just from a high-carb diet either. Age is still a major driver here, probably still the biggest one. Again, I expect to get a lot of hate comments about that one too. But look at the numbers. Just look at the numbers. We think about heart attack and stroke just killing old people. Well, the bottom line is heart attack and stroke do not have to kill old people. We'll talk about that one in a minute. Number 5, you cannot supplement your way out of a bad lifestyle. I don't know that there's that much discussion that needs, well, I do have to say that. We see this all the time. Everybody is, or not everybody, but so many people are grasping for the next supplement. I agree. The top 3 priorities in terms of lifestyle are diet, diet, and diet. But there are other things that are important. Obviously, sleep is very important. Stress is important. Exercise is important. But you can't supplement your way out of needing to lose 20 or 30 pounds. It ain't going to happen. And guess what? Number 6, you can't medicate your way out of needing to lose 30 pounds. You just got to do the work. Number 7, like it or not, medications have a place. Number 8, like it or not, statins have a place. That includes statins. Number 9, whether the docs like it or not, supplements have a place. Number 10, periodontal disease is causally related to CV inflammation. We've been arguing that. The CDC and everybody else are acknowledged, 30 years ago. There were billboards on the side of the road 30 years ago about the relationship between periodontal disease and heart attack and stroke. But it wasn't until a couple of years ago that some of the definitive research actually indicated that, yes, it's causal. We've always known about a connection between periodontal disease and heart disease. And from my perspective, the reality is I think most of that's driven by something else, insulin resistance. Because we know that insulin resistance, type 2 diabetes, prediabetes, causes both periodontal disease and heart attack and stroke. But again, there's been research which shows that the periodontal disease itself does let bacteria in, does create inflammation, and that inflammation is a cause of heart attack and stroke. Number 11, CV inflammation is a far bigger cause of heart attack, stroke, death and disability than high LDL. Our medical standards are wrong about that. They still continue to ignore CV disease. Cardiovascular inflammation. Now, I will say this. LDL is not totally off the plate. It is an actor. But the biggest actor we continue to ignore. That's the problem. Number 12, over half of adults have insulin resistance type 2 diabetes. Again, I don't have to, that's not my belief. That's research from the University of California, LA. And guess what? We're not talking about adults 60 or over or 50 or older. We're talking about adults 30 or over. John did a video on that, and I keep wanting to go back and do another one because we seem to not be getting it. As I've said here, it's far more than unfortunate that we don't understand it. It's tragic that docs and patients, most of our society, is ignoring the fact that the number one cause of death and disability, heart attacks and stroke, are right in front of us. We don't feel it. It's sneaking up on us. It's boiling us like a frog slowly boils in water. And most of us are doing absolutely nothing about it. Number 13, insulin resistance, type 2 diabetes, prediabetes is the major cause of cardiovascular inflammation and therefore the major cause of death and disability. And yet, we continue to ignore it. Number 13, insulin resistance, type 2 diabetes. Number 14, there are 58,000 names on the Vietnam Memorial Wall. It was a huge tragedy. I lived through it. But 58,000 people die every 3 weeks from type 2 diabetes, insulin, prediabetes, cardiovascular disease. And 3 weeks from now, 58,000 more will. These decades, again, we keep saying, well, that's because they're old, so that doesn't count. These people could have lived 2 decades longer. It does count. And again, That is an absolute that if you haven't heard that on our channel, like I said, shame on us. But it's there. And if you don't want to hear it, you don't want to acknowledge it, shame on you. These deaths could happen 2 decades later. I've already said that. Again, as you can see, there's passion here, and I'm risking, I know, the edges of going into a rant. Number 15, fasting, whether mimicked, intermittent, or prolonged, decreases the root causes of type 2 diabetes, insulin resistance, and prediabetes, high blood sugar, and insulin. Fasting does. Kudos to those that are doing these types of fasting. Oh, I forgot to mention 5-2 fasting. Anyway, to those that are not doing fasting, and I've got plenty of folks, some patients, and a lot of patients, just our culture has gotten away from fasting. And guess what? If you're used to eating 3 meals a day, 4 meals a day, plus snacks, I understand. You know what? I've been there up until a few years ago. Gosh, what? Well, I did, well, I'm not going to get into my own fasting history, but I've done fasting on and off for many years. I just didn't know that it was so important, and had given it up until a few years ago and restarted it. So, John Walker, yeah, the research on a lot of things, a lot of key questions that we're asking, like, what's the role of FOXO3? What's the, how much do statins actually work? Et cetera, et cetera, et cetera. You know what? There's science going on, and they're not that simple. If you want to hear somebody tell you that garlic is clearly going to clear up your problems, this is not the right channel for that. This is a channel where we look to tell you what's known about garlic. And we've done just that. So I know you didn't ask about garlic, but your comment is about the research, and it always seems inconclusive. There's a lot of stuff that's very conclusive here. In fact, the key points of this channel are very conclusive. Those are the ones that I just covered. Again, thank you for your interest